nowadays there's these tools that are built into feedback systems, Roman feedback systems, that can give you a warning signal when a client's not progressing well enough, and it's what we call a not on track case.
In the book, we've written a chapter that delves into this topic. Why are some cases not on track? There's no single answer to that question. And that's because there can be several obstacles that get in the way of effective therapy. For example, some of these could be external to the therapy process. They could be life events or interpersonal problems or financial hardship that may be occurring in the patient's life that are understandably exacerbating their distress. But some of these obstacles could be internal to the therapy process. For example, they could be related to the therapeutic alliance, difficulties with the alliance, or they could be related to difficulties with motivation to change or low expectations of improvement. In the book, we outline what is known to date about these therapy processes and contextual factors that are associated with poor treatment response. One example, a patient may be deteriorating instead of improving, and it might be that that person's anxiety is getting worse because perhaps they aren't implementing some of the graded exposure tasks or strategies that we discussed in therapy. That might lead me to come to a hypothesis that might have something to do with motivation to change. Maybe the patient isn't so motivated to implement these change methods or these coping strategies outside of the therapy sessions. If that's my hypothesis, I could use a tool such as a decisional balance exercise, which is designed to support the development or the increase in patients' motivation to change. Based on the hypothesis, there may be a deficit in motivation to change. If in the next 2 weeks I see that my patient is now doing the graded exposure tasks and benefiting from it, that might confirm that my hunch, my hypothesis about motivation to change being the problem, it was a correct hypothesis.